Air travel and pregnancy. Obstetricians are commonly asked to give advice on whether it is suitable for women who are pregnant to fly during pregnancy. Such advice is sought because of the physiological and environmental changes associated with commercial air travel and also because of the possibility of preterm labor or an obstetric emergency developing while in flight, particularly in those who are approaching 37 weeks of gestation or who have risk factors for preterm labor. Cabin altitude. The barometric pressure is significantly lower than at sea level, and there will be a concomitant reduction in partial pressure of oxygen, resulting in a reduction in blood oxygen saturation by around 10%. Such a reduction does not pose a problem for healthy individuals, and this remains so in pregnancy. Owing to the higher count of red blood cells in fetal circulation and favorable properties of fetal hemoglobin, there is considered to be little, if any, change in fetal oxygen pressures. With regard to any adverse effects of air travel on pregnancy, there are no good data to suggest that commercial airline travel is associated with an increased risk of adverse pregnancy outcome in terms of preterm labor, preterm rupture of membrane, or abruptio. Although there is no specific risk to pregnancy associated with commercial air travel, it is important that the obstetrician is aware of conditions which may complicate the pregnancy and could lead to an increase in risk of problems. The conditions are severe anemia with hemoglobin less than 7.5 gram per dl, a very important SPA, recent hemorrhage, otitis media and sinusitis, serious cardiac or respiratory disease, recent sickling crisis, recent gastrointestinal surgery, including laparoscopic surgery, where there have been gastrointestinal procedures carried out and where suture lines on the intestine could come under stress due to reduction in pressure and gaseous expansion. A fracture where significant leg swelling can occur in flight is particularly hazardous in the first few days of a cast being placed. Prolonged air travel results in a small increase in the absolute incidence of venous thromboembolism of around threefold, with an 18% higher risk of venous thromboembolism for each 2-hour increase in flight duration. With regard to minimizing the risk of deep vein thrombosis, appropriate general advice would be to have an aisle seat to facilitate ease of movement, take regular walks around the cabin and or carry out in-seat exercises approximately every 30 minutes on a medium or long-haul flight. Maintain a good fluid intake and minimize caffeine and alcohol intake to avoid dehydration. Make a specific individualized risk assessment for thrombosis in pregnant women who are flying. For medium to long-haul flight lasting more than 4 hours, it is suggested that all pregnant women are advised to wear properly fitted graduated elastic compression stocking. Indications for prophylactic thromboprophylaxis. Women who may have additional risk factors for thrombosis, such as a previous deep vein thrombosis, symptomatic thrombophilia, morbid obesity, medical problems such as nephrotic syndrome, can give low molecular weight heparin in doses as recommended for antenatal prophylaxis for the day of travel and several days thereafter.